Hello, South Ribble. Welcome to my fourth coronavirus Q&A, receiving your questions both offline and live, hoping to answer them or kind of give you some insight into what's going on now. We're 2 months into lockdown. I hope everybody's keeping well. I hope you and yours are all good. I hope you're still obeying the social distancing, washing your hands regularly, but now enjoying the fact that the garden centres are open and we're starting to head into phase two. We're starting to put in place those measures that allow us to return to normality slowly and safely. And I'm sure that that's some of the things that we'll touch on today. As previously, I have had a couple of questions come in, so I'm going to start with those, and then please do post your comments into the live feed, or as we've discussed previously, if you think it's a bit more complicated and you don't want to post it into the live feed, either have a look at my website for some guidance, which is katherinefletcher.uk, and if you say /coronavirus, me and my team make a special effort to put latest government announcements up there, latest press conferences, so you can find it by section. If you want to talk to me directly about something that's really super specific, absolutely the best thing to do is to email with your postal address so we can check that you're from South Ribble. And that email is katherine.fletcher.mp@parliament.uk. So if I start with the first of the questions that have come in, Julian has asked about testing in care homes. He's got further local reports that care homes are struggling to access the antigen tests, so the tests for the virus. Again, Julian, I'm going to say what I've said previously. The last Lancashire Resilience Forum, LRF meeting, that I heard from, is they believe that if a care home needs a test, it can get one. There are some concerns about future capacity and the need to repeatedly test. So to remind those of you that perhaps are not following this super closely, the issue with the test for the virus is it only actually goes, oh yes, you've got the virus, within quite a tight window when you're actually producing the viral load. So to continually check that people are safe to work in a healthcare setting or in any other setting, it's an idea to have repeated tests. And I know that there were some questions about capacity for continued repeated tests, but I understand that's getting sorted. A specific care home that's not had the opportunity to access a test now, I confess I haven't heard of. But again, as I've said previously, if you have specifics, you have the name, the address, don't put it on the Facebook feed. Please write into me directly, and I have mechanisms to raise and ask questions and make sure that the mobile testing units get to the right place. Okay. So Julian also asked, he was with the development of testing, that he didn't believe that there was a survey done of people who are asymptomatic but positive. So in normal speak, you've got the virus but you haven't got any symptoms, which it seems to be quite a lot of people. I've mentioned previously I'm part of the Science and Technology Select Committee within Parliament, and we've been sitting regularly, we've sat once a week to hear evidence and make sure that we almost capture what's going on in the moment rather than it all being a retrospective hagiography. And one of the people who gave evidence was a chap from the ONS who was talking in quite some detail about the fact that there is a national set of tests to try and track exactly that. How many people in the population are getting infected with COVID but are not presenting with symptoms? They originally did that between, let me just double check, between the 27th of April and the 10th of May on about 10,000 people across England. I know that they've now almost trebled that, so 25, maybe 30,000 people are going to be part of this reference study, and it's going to be representative across the population. So those of you that caught last night's press conference, the first study, how many people in the UK have had it, that's asymptomatic and symptomatic, it's about 0.27% of the population, give or take a bit, but very solidly less than 1% of the population had COVID between the end of April and the middle of May. Within that, there is a rate of asymptomatic transmission that they can measure. And as soon as they get through the 25,000, I think they'll have some much more solid data. And I would like to pay tribute to them. I think it's Professor Penrose was saying, he was first asked to think about this study in the middle of March. And he said it's the fastest he's ever seen from study design, practical implementation, all the way through to actually having it out in the field, receiving and analysing results. He said it is a remarkable speed of turnaround for something that, you know, still involves 10,000 people and a lot of scientists looking at it. So whilst we all go and clap for carers on a Thursday, and it's important whether they care for us in nursing homes or they care for us in hospital or they work hard in hospitals, but it's important to remember that there's an awful lot of other types of people sleeping under their desks, including the scientists, to get us the data we need. And so I want to thank Professor John Penrose and the ONS team. And Julian, I hope that answers your question. We are starting to track asymptomatic transition. And as soon as that number's solid, they'll plug it into these big models that they talk about, and that will really help us make a difference and understanding what measures we can take as we start to come through this phase of lockdown and we start to gently release measures. Alan has asked about employers. So obviously we're starting to enter phase 2, and as of Wednesday we were encouraging people to have conversations with their employers if they're not in the businesses that are mandated to shut. So as a little reminder, pubs, cafes, you know, that hospitality and leisure sector particularly, where people congregate. So the government's mandated those to shut, and they have a very specific set of measures to support them. But other employers, I know some have been working. And Alan's question was, surely you can't ask people to go back to work until the employer has conducted the risk assessment. Alan, you're quite right. That's exactly what we're saying. We're saying start to have a conversation with your employer, and we have issued a set of guidelines which are quite dry and technical, so I won't necessarily get into them here, about what employers need to do to make their workplaces COVID safe. And for larger employers, so with anyone over 50 employees, we've actually mandated a set of reporting that needs to happen to make sure we can track what's going on. And I make no apologies for saying this. If anybody here has got concerns about going back to work and the social distancing measures that their employer is putting in place, I would love to hear the specifics of that. So please email me, katherine.fletcher.mp@parliament.uk, and if it's within South Ribble, then I'd be delighted to help and just understand the detail. I've helped some people already, and actually when we really got into it, there was perhaps a misunderstanding on both sides. But that's not to say there isn't sharp practice out there, and if you hear of anything going on, I want to know, and then I will help us sort it. Okay, Craig has mentioned about the recent very positive announcement about the development of a secure antibody test. Those of you that have watched a number of these will know that antibody tests really is the game changer, because it allows us to understand who's had it in the population and you know how many people have had it, what level, therefore we can plug that number into the models and allow us to understand what relaxation we can do of the social distancing rules. It's important for a whole host of reasons. Craig makes the point that at the moment we don't have an understanding that you having antibodies is the same as you being immune, and Craig is correct. So I know that there's quite a lot of work going on to establish that, although some of it does just require time. Now, in most diseases, if you have an antibody, you can't get the same disease again. That's the basis of why you get vaccines, because that helps generate an antibody response, and it means you can't get the disease. COVID's quite different in lots of ways, but we have no evidence yet to suggest that it doesn't operate like that. So I think it's still important to understand through antibody testing, if and when we can get that expanded and rolled out, how many people have got antibodies in the population. But Craig, you are correct, it doesn't imply immunity. And when we talk about measures and we start thinking about social distancing and what we can do to start to gently release the lockdown in a safe way, people are very aware of that. So to give you some reassurance, there's no misunderstanding between the two in the people setting policy or the people advising them. What I would really look forward to seeing is that antibody test coming out. And my congratulations to the teams that have not only developed them, but also have done all of the hard yards to make sure that they're right. I think you've heard many times there's no such thing worse than an incorrect test. And something that can give us a secure idea that you have actually got the antibodies about 28 days after, really very valuable. And then finally, why are, I think Craig's also asking, why are risks based on age not available to the public? So I think we're starting to understand really what different factors affect your likelihood to become really poorly with this disease. And it is true that if you are a bloke, you are likely in percentage terms to have a serious case of the disease rather than if you're a woman. But also there's quite a good graph. I'm going to draw you a mental graph. So if that's numbers, either way, numbers of girls, numbers of blokes, and that's ages, so 0 to 10, 10 to 20, all the way up through up to 80. If you draw that graph, then the graph looks like a palm tree. So relatively low or almost negligible. So if you're under 10, I think it's like 0.003% chance that you're going to get kind of a serious case of serious disease in COVID. But as you go up the palm tree, if you are a bloke, your palm tree leaves get quite big, and if you're a lady, then or a lass, it gets bigger, but not at the same rate. So I think that data is available, and there is for those of you that are really minded to get into the detail of it, rather than me continuing to draw virtual graphs, Professor Chris Whitty has had a lecture series that he did, released on iPlayer, BBC iPlayer. And it's a bit dry. It's a very clever man, stood in front of a lectern, delivering, slides on a podium. But that detail that I'm just quoting to you is from that. So I will put the link in the feedback at the end, in the comments at the end, and I'll also put it on my website. So for those of you that are interested, you can go into iPlayer and maybe catch that back up again and start to see some of the things that are known about COVID, some of the things that are unusual about COVID, but crucially the things we don't know, like do antibodies confer immunity? So we'll do that. Okay, I'm going to switch over now to the live feed questions. Again, you'll have to bear with me because I'm not brilliant at reading and talking to you at the same time. The second Leyland Scout Group. Hi, Catherine. South Ribble Council are not paying out the RHL grants to Scout groups when other district councils are. Can you please advise why this is the case? Sorry, second Leyland Scout Group. I don't have to hand why there's different approaches within different councils. I'd love to hear from you directly on the email with the details, and then we can speak. To my knowledge, I'm not sure Scout groups are a leisure activity, so are deemed as a leisure sector. So there's a range of packages available to support, and rather than me going to reel down in the detail, do you have premises, has it got small business rates relief, do you have charitable status, let's take that one offline. Please write into me and then we can talk. But I've chased a few of these before where people saying, I've seen on Facebook that I am in group X and that these people over there are getting help. And when you get into it, it's down in the circumstances. What I would say is there's a really unprecedented range of measures available, and because we understand that you can only put a certain rule in and it doesn't work for everybody, we've released the discretionary fund for grants for the local councils, and that's £600 million, of which it will be allocated out to the local councils, and it gives the councils the opportunity to say, okay, so we really need to help these people, but the rules didn't allow us to, for want of a better way of putting it. So we've given them a pot to help, just like that, help businesses and all sorts. So I would hope that that's something we can sort, but I can't guarantee it, and we are probably better taking this offline. Kevin Matthews, I've just successfully applied for my self-employed support grant. Simple process, very impressed how HMRC got this in place. Oh my God, Kevin, they have done, they've released it early. I mean, and when you have some kind of working understanding of the IT that the HMRC have in their big base down in Telford, they have done an absolutely phenomenal job. This is completely brand new. They're very, very tired. So if you don't mind, I'll depersonalize it and maybe pass on the feedback. My business is almost entirely reliant on international travel taking place, so I'm anxious to hear details of how the scheme is being extended to help me get through the rest of this year. Yeah, Kevin, we know. So I was pleased to see the Chancellor Rishi Sunak, before he had his tiny snafu voting in the wrong lobby. Maybe we can do virtual voting another time. He announced the increased flexibility from August of the furlough scheme, but also that's going to extend it for a certain period of time. We need to be guided by what the rules are and what the science are. So because it's so fast moving, we can't necessarily be definite too many weeks or months out ahead, but the commitment is absolutely there to help. I was actually on a call with the Aviation Minister, Kelly Tolhurst, yesterday, just to understand what's happening in terms of supporting airports, supporting the travel industry, but also how that interacts with quarantine and the Home Office rules and the Department of Health rules to keep us safe moving forward. And you can imagine, you know, there are three big things. Any specific questions, please do email in. I won't repeat my name again, but my email address again. But be assured it's very much in the thoughts, and as soon as we can give guidance, we will. But what we really don't want to do is give guidance that we then have to change, because that gets really messy and complicated, and I'm sure you can understand that. Understand the picture, then issue the guidance that's relevant to the solidly known data is the theory. Tracy, hi Catherine, why is something not being done about the hundreds of economic migrants who are arriving daily over the channel and possibly presenting with COVID and even being put up in luxury hotels? Tracy, I separately on Wednesday I was on a call with the Home Office colleagues. I think the luxury hotels is probably just a Facebook rumor. I don't believe that's the case. They are very seized of this. So they are imposing testing. They are quarantining for 14 days. And I understand that there are some fairly intensive negotiations going on with colleagues in France to make sure that, you know, we are aligned in the rules about allowing people to turn around and send them back. You'll forgive me if I don't necessarily make up policy on this live Q&A. It was a good 40-minute discussion, but it was extensive, and believe me, people are very seized of the challenge, not only because these poor people who are being sold, if I can put it in Northern, an absolute pup by gangsters who say, this is the land of milk and honey, give me 10,000 of your currency and I will get you across. They're putting their lives at risk trying to put them across the channel. It's one of the busiest shipping lanes in Europe. So it's not just a question of biosecurity, it's a question of making sure that vulnerable people aren't exploited by gangsters. So very seized of it. When are you going round? Martin says, when are you going to get round to replying to emails? Oh, sorry, Martin. I think I've got an auto response. So we're still literally getting hundreds a day. So what we're doing is we are prioritizing people that are in immediate distress or need, be that with housing or finances, or maybe even, you know, some challenges with their mental health. We're then doing the kind of broader practical support, you know, taking what you write in and say to me back to ministers and saying, these people have this issue, you know, what are we going to do about it? How can we structure to help? There are a set of people that are writing in saying, this policy here is good, or this policy here is, you know, perhaps needs to change. And Martin, I will confess that those kind of policy think piece type emails have gone towards the end of the queue. So if your email was in the first two, please do write back in again. If it was more a kind of policy response, we've got lots of people writing saying the government's doing a fab job, and we've got lots of people writing in saying the government's could be doing better in this area. I confess those are further down the track, because my job is to help the people of South Ribble and get government to help the people of South Ribble. So it might just be in the nuances. Please do email in though, because trust me, I'm not doing anything else for about 15 hours a day. Bob, why are people being asked to stay away from areas of outstanding beauty? Surely a wide open beach like Southport with a picnic and my family is not harming anyone. If we can't go now when the rules have been relaxed to permit when we can go. Bob, there's loads of confusion about this. Let me give it you as clear as I can. You can travel for any distance to spend time with your household if you socially isolate and if you socially distance when you get there. What you cannot do is stay overnight. So that imposes a natural limit on travel. But as we're starting to come into this phase 2, you can exercise in a limited way. You can walk down Southport Beach and have a picnic with your family. What we'd ask you to maybe not to do is have a picnic at the picnic table, unless you've got a way of cleaning or sanitizing that. Maybe take a blanket, sit on the beach, stay 2 meters away from other households. But you can do that. This is all about stopping household 1 infecting household 2. The epidemiology and the evidence suggests very strongly that it's joining these nodes up, which is really the primary mechanism of transmission. So the idea, so you can go and for a walk with one person from another household, provided you stay 2 meters apart. And it might seem a little arcane, but what that is just as about releasing it very gently. And then we're going to look at the data. I'm going to see if that's done anything to it. And then if that's all fine and we're keeping that R value, that transmission in the community value down, then we can release it a bit more. It's all about just making sure that we just take those incremental steps, because I think we can all agree that absolutely the worst thing that would happen is if we just completely open the tap, then we end up in a situation where R is rapidly increasing and we have to go back to complete lockdown again. So I hope that's answered your question, Bob. Ian is asking, why is it we can meet a family or friend in the park surrounded by hundreds but can't go and sit in a family member's garden surrounded by no one? Ian, you can go and sit in a family member's garden because you're one person from a household and you can go and talk to that household. What we're trying to stop is 2 sets of households coming together, because so I haven't been to see my family members yet, because it's going to be really, partly because I'm answering emails and partly because it's actually going to be really hard to maintain that social distance, especially if there are children there. You know, children want to run and hug their grandma. So I hope I've kind of answered it. It's about a gentle increase. So you can go to a park surrounded by hundreds, provided everybody is 2 meters away. You're not all touching the same gate handle, or if you are, you're washing your hands and hand sanitizing, because in an outdoor context, the evidence suggests that the coronavirus is quite a heavy little thing. So a transmission via aerosol, the vast majority of it is dropped to the floor within 2 meters. And that's got a safety limit on it, actually. It's probably slightly smaller than that. So that's the difference. You're not going to hug a stranger in the park, but you risk being, I believe the phrase is, socially intimate with people that you know in your family. So by all means, go and sit in their front garden, but on your own, not as big groups of people, which is harder to track. Martin has come back again. What about PPE for non-teaching school staff that are required to be in school to facilitate key workers to work and not look after the kids? So Public Health England have issued a very well thought through series of tables about what appropriate PPE is for individual areas. I'm not super familiar with what they say exactly about PPE for non-teaching school staff, but I know that PPE is available should they feel it's needed and for the appropriate level of risk. The key things in a community setting like that, without confirmed COVID cases, is wash your hands and stay 2 meters away. But now we're starting to relax it. We know that the kids going into school are really not going to maintain 2 meters. They're children, and bless them, brilliant. So we're going to release certain sets of year groups in and see what that does to the R value, the rate of transmission. PPE in and of itself is really important to prevent an individual getting infected, but if there's no disease present in the environment, then the appropriate level of PPE has been defined by people that are much cleverer than me. So if you can't access that PHE guidance, I actually have all 4 slides and I can share it with you, but the schools are doing a wonderful job. They have access to that properly put guidance, and I have every confidence that they will be giving exactly what the key workers need and the teachers need. And if anybody believes that that's not the case, please write into me, but be specific. I get lots of people saying this is happening in this sector, but when you get into it, it's maybe just a generic statement and you can't find the specific example. You give me an example for South Ribble and I will sort it to the best of my ability. That helps. Andrew, how long can the country fund the furlough scheme for? Andrew, that's the $64,000 question. Right now, and I think you will understand this, we're doing everything we can to save lives. It's about saving lives. We're all human beings at the end of the day. And by now, I'm sure you've understood, if we had done absolutely nothing, the data is quite solid on death rates, and you were looking at hundreds of thousands of people in the UK. We know we need to get the economy going. We've generated the most unprecedented set of measures in peacetime. And I get really positive feedback back from businesses, you know, furloughing employees, supporting the self-employed, grants for specific sectors, VAT holidays, tax holidays, rates holidays, you know, it goes on, discretionary grants to help specific people in circumstances. It's huge, it's very expensive, but it's in place for a reason. So I would like to reframe the question and say, when does the science show us that we don't need to afford this anymore? Is the view, or how can we start to transition to make sure that we don't end up with unmanageable levels of debt from what is a once in a century event? Let's remember that. Catherine's asked, I was on maternity leave 18-19 but made a profit 19-20. Unfortunately, I won't get any help on the self-employed scheme. My PhD stopped using no funding from there. Catherine, I think you need to apply to them. So the SICE, the Self-Employed Income Support Scheme, it's an average of over 3 years, so 3 years earnings. So if you were earning 17-18, you were on maternity for part of 18-19, and you've done something 19-20, it will take the average of those 3 years. So you're right, there will be a step down because your income was restricted whilst you were producing a child. Hello, hope the child's lovely. Do you know what I mean? But that's why it was done over 3 years, to make sure that there's no unfairness in the system, and people that have maybe had periods of illness or periods of maternity or periods out of work can still get the support that fairly reflects their contribution to the taxpayer over the last 3 years. So if you haven't done that calculation, it may well be worth doing, because it's not any given point in time. Jacob's asking, what about kids who are in care homes? Are we allowed to visit our family and hug them, yes or no? God, such a heel saying this. If they are in a different household at the moment, no. You can go and see them on your own and stay 2 meters away, and I really want to go and give my mum a hug, but that very close contact that happens between families is a huge part of the rate of transmission. So if there are households living separately, and there's a really long list of reasons why that's happening, there are. I even understand today that Sandhurst has effectively designated itself as its own household, even though there are hundreds of recruits there. It's this concept of household and who you're living with. But if there's something really specific about that, please do email in. I can't give you the answer I would like to give you and you want to hear, but I will. And my commitment here is to tell you the truth as I understand it. Natalie, what is your view on children going back to school, as it seems to be a lot of worries regarding this, and if this can be done with social distancing? Okay, so Natalie, I think I've touched on this. We know the kids can't effectively social distance, but that's not necessarily an issue if the rate of coronavirus infection in the population is at a level where it's really unlikely that the kids are going to do it. We don't know, which is why we've not just gone, okay, let's open all the schools. We're saying let's open individual year groups so that we think it's okay, but the risk isn't huge, and then let's just check that it's okay. What I would say about the schools thing, there's an awful lot of people very afraid for their children. Please go back to the start of this, or maybe even look at Chris Whitty's side. If you are under 50, unless you have an underlying health condition that perhaps makes you more vulnerable, you're really unlikely to get this nastily. And there is still a question about whether kids get it from their parents or actually their parents give it the kids. Because, if you're under 10, there seems to be almost no visible effect of the virus. And I'll save you some of the scientific speculation as to why that is. So the children of our communities are some of the safest in the country in terms of the risk of having a really adverse negative effect of this coronavirus disease. I think it's really important to bear that in mind. I hope that helps, Natalie. I wouldn't be I've got primary school aged family children. I wouldn't be sat here saying anything that put them in jeopardy, I promise. Emma, you've just said people are unlikely to hug strangers in a park. Don't you think children will hug each other at school? I think, Emma, I hope I've just answered that. We know that's the case, but if there's no virus going around, then it doesn't matter. So it's a mechanism of stopping it getting into the school in the first place and stopping that household to household transmission that's key. Natalie says she doesn't want her children to be used as guinea pigs going back to school. Local school hygiene is absolutely disgusting. So I have no assurance to believe what they will be doing going forward. Natalie, we are not mandating you to send your children back. You're a mum. You can make your own choice. We are issuing a set of recommendations and guidance about how the country collectively and together steps out of it. If you hold that strong view, there is going to be nobody coming around and knocking on your door and mandating you sending children. I believe strongly in the science enough to believe it's a responsible and accurate thing to do to recommend that certain year groups can start to go back. But if you hold that view, you hold that view. But at some point, we are all going to have to play our part in becoming, in stepping towards a new normal. Certainly until either a vaccine arrives or a treatment arrives. And there are positive indications on both of those. Nikki Baxter, if someone got a shielding letter, will those who are shielding for 12 weeks automatically get an extension letter? Nikki, I'm terribly sorry, I don't know. I would strongly suspect so. But I don't know. I don't think we're at the point where we're close enough for those shielding letters to run out. And I think we want to get closer to an understanding of what's going on within the science. But they are the most vulnerable people in our community. We really do need to look after them, and I would find it very likely that that's going to happen. But that's just me riffing. That's not me knowing. Ian, would it be possible to have it confirmed that I can go and visit a family member friend in their back garden? Obviously, just the two of us and abiding by social distancing rules. Yes, Ian, we've said that you can meet an individual outside if you're within 2 meters. So you can play a round of golf with them, you can go for a walk with them. If it's, you know, households. I hope that helps. Will the government put pressure on travel companies and airlines to refund people their money instead of forcing them to take credit? Andrew, this is another one of the thing I mentioned. I was on the call with both Home Office and Transport Ministers yesterday. I know they are very in the detail of this, and it gets quite complicated quite quickly. I don't believe anybody will be out of pocket long term. I don't know what the short term solution is. And simply put, that's because if until the airlines can start to get a revenue stream in again, if they pay out all of the necessary refunds now, that they will have their own issue. So it's almost robbing Peter to pay Paul. Trying to understand who can maybe take a voucher, who can take a refund slip, who can access a refund through their credit card or debit card insurance that's been used, who can access their travel insurance. It's trying to make sure that there's more than just Peter and Paul in the equation. Having said that, if people are in specific financial distress and really need that money, because they're not insignificant sums, some of these, then can I encourage people to write into me directly? Because what I've just said is a general indication rather than an absolutely blanket rule. So Katherine.Fletcher.mp@parliament.uk. Judy's saying the vulnerable can't be locked in a room for months. Judy we can't lock anybody up. We're a functioning democracy. So if you're in the shielding group, we can send you a letter and say we really strongly advise you do this. But if this is about us developing a sophistication that's really hard to communicate about what we want to do with our lives, and what level of risk is acceptable to us, and what we're trying to do is say to people, we believe that if you're in the shielding group, for example, that you have a high risk, and we want to make every effort to tell you that. But if you are in the shielding group, and I've heard there's quite a good video on social media. It's a lady who's in the shielding group and he's waving her shielding letter, but he's also walking, and she looks fairly elderly. I've seen off Hitler. You're not telling me to stay in the room. We're not going to arrest her for doing that. That's her choice on the risk. But she understands the fact that if she catches COVID-19, there's a high risk for her. It's still a minority risk. The majority of people, whatever age group, that get COVID get better. And that's absolutely rooted in the science. And again, if anyone's interested in this, please do watch this Chris Whitty lecture. However, the older you get, or the more underlying health conditions you get, or a range of other factors, it means your risk of becoming really poorly increases. But ultimately, it's your choice about that risk. But we've asked everybody to play their part together. And we are asking people to maintain social distancing and hand washing, if not for yourself, for others. But your question was, are we going to lock people in a room forever? No, we're not. But our strong advice to them is be careful. And our strong statement to everybody else is play your part in helping to look after these people by sticking to the social distancing rules. I hope that helps. Damien has said, so can you confirm that parents can make a conscious decision as to whether children go back to school or not when they reopen without fear of fines or record as unauthorised absent? I don't know to confirm about unauthorised absence. In this immediate phase 2 period, I will be astonished if we are fining people. I don't have it definitively. I don't have the education guidance in front of me. But what I would say is, if everybody, if we don't try and move collectively as a pack, we risk losing a lot of the value that we've generated together by working together. But if there are specific examples, so parents with shielding letters due to underlying health conditions with children, what I would encourage you to do in any given circumstance is you speak to your local school. The schools have got much better levels of guidance than me. I'm by my nature a generalist as opposed to a specialist. Talk to your school, engage in a dialogue, understand what the school's got to say. I know that the vast majority of people are happy to be guided by the school, what the school's doing, and the restrictions around class size and stuff, to be careful. But this is an unprecedented set of circumstances. What I would say is listen to the science. We're not putting children at risk. I strongly believe that, and if I wouldn't advocate for it if I believe we were. Karen saying, I work in a special school, there's no social distancing. 2 staff to hoist, changed it, children near touch you. PP hasn't been offered, but some children not tolerate it wearing it either. I do this and I can't see my family even though we are social distancing. Karen, I'm not sure what your question is. Firstly, thanks very much for being a carer in this environment. You're doing an amazing job. I've worked in adult social care, and it's hard physical work, using those hoists. It is a 2-man job. You mentioned not being able to see your family. Yeah, it's that concept of household and something else. Please write into me so I can understand better. Let's see what we can do. We understand that there are specific areas where you can't maintain social distancing, and therefore that area almost becomes the concept of a household. Sandhurst is not a household in the way we would think of it, but for the purposes of coronavirus, it is being treated as one, and the social distancing then goes on outside of Sandhurst. And I deliberately picked that because it's young, fit people that are, do you see what I'm getting at? So a social care special school also has that ring fence concept to it, which is bolstered by testing around it. Joseph is asking, what's my views on the extension of SICE? Joseph, we've not made any announcements yet. Pleased to see the furlough coming in and the support there. I don't know, I can't commit either way, but we're trying our level best to do everything we can to make sure that our economy doesn't completely grind to a halt, so that we can come bouncing back out of this. And I think SICE is a huge part of that. I don't know whether you've seen, but there's some polling comparing different countries' economic responses, and not asking the governments, but actually asking the people on the ground. And Britain comes top in that by quite a distance in terms of the range of measures that we've put in and the thought and hard work that the Treasury team have put in to having things in place. The Sybil's loans had some practicalities, so they worked with the banks and created the bounce back loans, and the bounce back loans have put something like £9 billion out in a fortnight to help people. I mean, it's amazing. It's amazing just from how have they done that, never mind the sums involved and everything else. It's what we can do when we work together is wonderful. Right, we're kind of, I think I've said enough on teachers, so I'm just going to see if there's anything else coming in, teachers and schools. No, I wonder whether we're kind of running out from that one, 45 minutes in. Listen, thanks for listening, thanks for tuning in, thanks for taking the time to ask the questions, because if you're thinking it, somebody else is thinking it. I'm sure in the last 10 minutes or so I've said something wrong. And I'll have to stand and correct myself, but continue to be marvellous, continue to educate yourself, continue to ask the questions that help us understand so we can keep ourselves safe against this flipping bug that's got us all in our homes and not seeing our mums and not being able to hug people that we love, and is making business difficult. we'll get through this by working together and going forward in a spirit of everyone's trying to do their best. It won't be perfect. Let's ask the right questions. Let's make changes where we need to, and let's move forward. So South Ribble, Lancashire, all the very best to you. Keep buggering on, and please do write in if I can help you.